hello everybody and happy Tuesday. Thank you so much for joining us today for a wonderful presentation by Melissa Fritz about the evolving role of nurses in healthcare. Just before we get things kicked off here, just wanted to let everybody know that for whatever questions you have, please enter them into the Q&A box. We do have chat disabled, but as questions arise, please feel free to enter them in the Q&A box and we'll make sure to ask them at the very end. And before Melissa begins her presentation, I just wanted to share a little bit about Melissa. Melissa Fritz is the Chief Nursing Officer and Vice President of Patient Care for Methodist Hospital. Melissa provides administrative oversight and direction for inpatient nursing, patient care services, and nutrition services. She is a strategic healthcare leader and change agent with experience in the clinical setting, operations, nursing leadership, and professional development. She's passionate about ensuring the delivery of the optimal patient experience, developing relationships and building trust within teams, and has a goal of creating a culture where everyone feels welcomed, valued, and included. Melissa received her doctorate in nursing practice from Baylor University, her master's degree from the University of Minnesota with a focus on the adult health clinical nurse specialist role, and her bachelor's degree from Marquette University. She is certified in executive nursing practice, holds a fellow designation from the American Organization for Nursing Leadership, and is the Minnesota Organization of Leaders in Nursing president-elect. Melissa and her husband, Pat, have 3 children, 12-year-old twins Brooke and Bryce, and 11-year-old Maddie. In her free time, she enjoys traveling, running, reading, and gardening. And so without further ado, Melissa, thank you so much for being here today.
Good morning, everybody. And thank you for taking the time. And Abby, thank you for that nice introduction. Absolutely. I'm going to test my luck with technology, and I'm going to try sharing my screen here. All right. Abby, am I on the right screen? Does that look okay?
It looks perfect. Thank you.
All right. Okay, well, thank you again for all making the time to be here today. I believe we have about 45 minutes together. We're going to try to keep the content to about 30 minutes to allow time at the end for questions. And we did put this slide in here, and just as a reminder, as Abby shared, just please follow the features there when it is time for the Q&A session. And I really do encourage you to try to see what questions you do have, because the evolution of nursing in healthcare is rapidly changing. And I would love to hear from this group on what your thoughts are, what you're seeing, and then certainly if you have any questions for me. So thank you all again for being here. Today, we're going to be talking a little bit about the historical context of nursing, the evolution of the traditional and advanced roles, the role of technology in modern nursing, and then how Methodist is really working to support our recruitment, our retention efforts, and really looking at our nursing workforce and how we continue to empower them and retain them. So nursing. So on your screen there, you see Florence Nightingale, and I will tell you the story about her in just a moment. But I thought if we're going to be talking about nursing and how it has evolved, I think it's really important to get a little history in here. So nursing began as an informal caregiving, often rooted in the religious service. And then in ancient and Middle Age times, care for the sick was typically provided by women or members of religious orders such as monks or nuns. And these caregivers really laid the foundation for us around compassionate and service-oriented nature of what we call modern nursing now. And then as we fast forward to the 19th century, as I mentioned, Florence Nightingale was really our founder of nursing. So wanted to make sure I spoke about her. During the Crimean War, she introduced hygiene practices that drastically reduced death rates and later founded the first professional nursing school. Florence emphasized that nursing required both scientific knowledge and that compassionate care. And I think today we always talk about nursing as really a science and an art, and it really stemmed from what Florence was saying there. A lot of Florence's work transformed the public perception of nursing, and it also laid the groundwork for who we are as a profession today. And then as you go into the 20th century, This brought significant professionalization to nursing with formal training programs, the specialization or the clinical specialization, and also the rise of APRNs or advanced practice registered nurses. Nurses took on roles in pediatrics, mental health, critical care, all of the different ologies as we call them, ultimately expanding the profession's reach and their expertise. Another piece that was really critical is during World War I and World War II, nurses were really critical, and this helped earn them great respect and help advance their status in the healthcare landscape. So today, fast forwarding to modern nursing, we now really, we're doing a really good job about integrating technology, looking at what that teamwork looks like, talking about evidence-based practice, looking at all of the research before we go ahead and do something. We are very focused on patient-centered care. We are doing our very best and always can continue to improve about addressing health equity and weaving that into everything that we do. And another really great thing about modern nursing is we're seeing a nursing leadership kind of rise as well. There's a lot of different opportunities and a lot of needs around nursing leadership, and we'll talk about that later. And so now, given it is Nurses Week, if any of you are nurses, happy Nurses Week. I wanted to share just a quick little history on that, and then we'll jump into some of the traditional roles. International Nurses Day was established on May 12th in 1974. Then national level recognition evolved with the first National Nurses Week in the 1950s. And then finally in 1993 and 1994, the ANA, or the American Nurses Association, established May 6th to May 12th as the permanent and annual National Nurses Week. And they end and culminate on May 12th, which is Florence's birthday. So happy Nurses Week, happy Nurses Day to all of you. All right, so I'm pretty sure most of you on here are aware of these basic responsibilities, but again, I think it's important to share with you like what are the core functions of nursing, and then again how we've evolved over the years and where we still have opportunity. So basic patient care, traditionally nurses have always been at the forefront of delivering that hands-on essential care. And this includes helping with hygiene, mobility, nutrition, toileting, making sure we're providing our patients with comfort. And these fundamental tasks not only support physical healing, but we work really hard to preserve the patient's dignity. When they walk into the hospital, what we always try to remind our frontline nurses is that our patients, they lose all control of everything. You know, they put on a patient gown, so they lose some of their privacy. You know, they're walking around the halls when we're able to assist them. They're going to MRIs when we can get them in the schedule. They're eating when we can deliver their tray. It's just they lose all control and they lose their privacy. So we really always try to make sure we are keeping the patient's dignity top of mind and just trying to give them any control back. Like, you know, when would you like to go for a walk, and try to incorporate some of that. So while simple in appearance, a lot of these actions are critical to preventing complications in our patients. When you're in the hospital, a lot of things can go wrong, such as hospital-acquired infections or pressure injuries. All of us are sitting in our chairs right now, and we might be sitting in one position just as a patient is laying in a bed. And you can imagine how many times you're shifting in your chair in this 45-minute presentation. Well, oftentimes our patients are laying in bed like that, and they might not necessarily have the strength to turn like that. So pressure injuries are a common thing in the hospital, and that's where nurses really come in. They can make sure they're educating the patients, helping them turn, and just talk about the importance of ambulating. So nurses are really at the corner of all of that. Another one is administering medications. Nurses have long held the responsibility of safely administering meds to patients, and this includes verifying that those medication orders are correct, checking for potential interactions or allergies, and to make sure we're administering at the appropriate time. Nurses are often the final checkpoint before a patient receives that medication, making their attention to detail and clinical judgment vital for patient safety. And later in the presentation, we're going to be talking a little bit about technology and innovation. And I will mention what we're doing with the medication administration to how we're using technology to make it safer for patients. Next is monitoring vital signs. Regular monitoring of the vitals, such as your temp, your pulse, your respirations, blood pressure. These are all, again, core nursing duties, and I'm sure not surprising to all of you to hear this. But these measurements really do offer immediate insights into a patient's condition, and they help identify early signs of deterioration. So when we're checking the vital signs every 4 hours or every 8 hours, the nurses are using their critical thinking when they're interpreting these on when to alert the physician, when to alert the healthcare team, so we have that timely intervention. And then last, but certainly not least, is providing emotional support. Beyond that physical care, nurses offer vital emotional and psychological support to patients and their families. And I think that's key here is nurses are not just supporting patients, they are supporting that whole family or the whole care unit. And our nurses at Methodist do such a great job with this, and it's the small things. When we're talking to the patients, we're also making eye contact with family members or whomever's in the room, or would you like a cup of water? So like all those small things are really important, because being in the hospital, as you maybe you have experienced, is really stressful. So anything we can do to provide that support to our patients and families, we always try to do that. All right, so now I'm going to transition a little bit. I'm going to tell you about the emergence of APRNs, or the advanced practice nurses, and how they have really reshaped our profession and continue to help enhance our care. So before I go on to that, I do want to stress the bedside role is so important, because I think, and myself included, a lot of us go back to nursing school. We're like, I want to be a CRNA, or I want to be an NP. And I really emphasize to nursing students whenever I'm talking with them, don't forget about the pivotal time and experience that you gain at the bedside. It is truly a special role. So as I transition, I just want to lay that there, that providing that bedside care and monitoring the nursing profession continues to grow and support us. And I think the great thing as we talk about the APRNs is to understand that our nurses now have more opportunities than we ever had to expand their scope, to deepen their expertise and lead meaningful change. And not just through the clinical pieces of it, but also through administrative and leadership roles as well. We have a lot of different leadership roles at Methodist and across all hospitals, which are necessary and crucial to continue to support the bedside and our APRN. So it is all roles in nursing. So these are the 4 types of advanced practice nurses. Many of you probably have heard of some of these, but I thought just to level set, we'll just kind of go through each one. And why I think this is so important for our community members to know about is there is work you can help us do by continuing to promote these roles, because they are so crucial. And I have a upcoming slide that talks about the exact impact of APRNs and why they are so important for our communities. But I thought I would first just talk about telling you about each of them so that we're all aware of what the care that they provide. So the CRNAs, or the Certified Registered Nurse Anesthetist, is an expert in anesthesia care. CRNAs administer anesthesia, and they monitor patients before, during, and after the surgical, obstetrical, or any diagnostic procedures. They're also really critical in pain management and patient safety in intense environments. And then I'm going to jump down. I'll come back to the CNS in just a moment, but I'm going to jump down to nurse practitioners. NPs, I think many of us have probably heard about, and also may have them as like our primary care provider in the clinic setting. But NPs, they really deliver that primary, acute, and specialty care. They diagnose and treat health conditions. They prescribe medications. They order diagnostic tests, and they also are really good at managing our chronic diseases. And as I said, they often are that primary point of contact in the clinics for helping a lot of our community members and our patients out. The next one I'll talk about is the certified nurse midwife. A lot maybe don't know this is also one of the 4 types of advanced practice nurses, but our midwives deliver comprehensive care to women across the lifespan. Midwives provide prenatal care, they assist with childbirth, they manage postpartum care, and they offer family planning and routine gynecological services. And now I want to tell you a little bit about the CNS role. And I am a CNS by background, and so I'm very passionate about this. I think this is probably of the four types, the one that the least amount of people know about, but it does hold a special place in my heart because I am a CNS by background. And I selected the CNS role because it is so versatile. And as I explain that, I think you'll understand that as well. So CNSs, or clinical nurse specialists, they provide expert clinical guidelines and guidance in specialized areas of practice. And they go in all different areas, but they do like to focus on one specific one. That's typically what they get their specialty in. So things like acute care, geriatrics, pediatrics, oncology, mental health, critical care. I personally, when I did my schooling for this, it was my master's, and I focused on adult health, clinical nurse specialist. So with CNSs, and a little different than nurse practitioners, CNSs can focus on direct patient care. They can have prescriptive privileges, and they also get their clinical expertise with leadership, consultation, education, and then they also work at that system and organizational level. So I always like to educate people about the CNS role and think about it in three different spheres. One is the patient-client sphere. The next one is nursing practice. And then the last one is that system or organizational sphere. So in the patient sphere, CNSs, as I said, can provide direct patient care. And they help with that consultation for really high complex and high risk patients, especially in the hospital. At Methodist Hospital, we tap a lot of our CNSs to be consultants on the case. If it's really tough, we're trying to manage through it. So they're super helpful in that. And again, they can provide direct patient care. So they can work in clinics as well, and they can assist with diagnosing, managing treatment plans. They can help coordinate care for individuals and families. And then the second of the third spheres is nursing practice. So CNSs can serve as mentors, educators, and role models to nursing staff. They assess clinical competencies, they promote those best practices, and they offer guidance to improve clinical decision making. By supporting nurses in their professional development, CNSs really help us raise that standard of care, that level of care for nurses in the profession. And the last one, before I move on to the impact of these APRNs, is talking about the organizational or the system sphere and how CNSs are really great in that element. Our CNSs at Health Partners and Methodist and Park, they lead across the system. So they lead a lot of our different quality improvement initiatives. They participate in policy development. They influence workflow, as well as resource allocation. They look at, and when we talk about technology, you'll hear me talk about them a little bit. They really help us and provide that expert clinical guidance on different technologies that are out there. What should we prioritize? They look at standardizing care protocols. And as I said, they're really good about working on those quality initiatives across the system. Like if Health Partners wants to reduce the amount of falls a patient has or pressure injuries, we often look to our CNSs to lead a lot of that work. So that's a little bit about the four types of advanced practice nurses. And now I'm going to step into talking about the impact that APRNs have and on these these three elements here. So the first one is improving access to care. The work here is especially impactful in underserved and rural areas because in rural areas, sometimes we have physician shortages. So whether it's a nurse practitioner or a CNS, but they provide that primary care in that community clinic, which is incredibly helpful. We can also have some of our midwives that offer reproductive health services. And these APRNs are helping to close the care gaps and ensure patients receive timely and high quality attention. The second one there, APRNs are contributing to improve patient outcomes. through their advanced clinical training. And as I talked about earlier, that really holistic approach, very patient-centered, they really have a significant impact here. And a lot of studies have been done looking at the role of the APRN, and they show that the care delivered by APRNs does result in optimal outcomes, particularly in that chronic disease management. Another area that they looked at was preventative care, as well as patient experience and patient satisfaction. Again, with APRNs having that really holistic approach, they take their time in the clinic, in the hospital setting, and they kind of walk through every single element with our patients, which certainly makes an impact. And then lastly, and additionally, because APRNs are often focused on early intervention or trying to be proactive and not reactive, they help with that continuity of care and that overall care management or care coordination. And it ultimately does reduce the overall healthcare cost because it prevents the hospitalizations. It oftentimes minimizes the patient complications. And then it also, they work on using our resources more wisely and more efficiently. So as we've kind of seen APRNs transforming how we deliver care, they're helping healthcare extend our reach and deepening that clinical impact and improving outcomes for our patient. And as I said before, with our bedside nurses and our APRNs, they're a part of the picture, right? But they're not the whole picture. Another part of this healthcare picture that I want to make sure I emphasize is that our environment is constantly changing. Therefore, those traditional roles are changing, APRNs are changing. And this is really marked by the increase in patient acuity and the complexity of the patient cases and also the family unit as well. We're seeing that a lot in the hospital. And I don't know if this was a COVID impact or not, but we are seeing the shift where the care is becoming increasingly complex. And so we are relying and need to rely on more innovative solutions and more technology to address our patients with these more complex care needs. So now I want to talk a little bit about what we're looking at in innovations in nursing and what this technology is looking like. So I'll kind of touch on these pictures that you see here in just a moment. But I think just taking, pausing and looking at how far we've come is quite impressive. Technology really is revolutionizing nursing practice. It's enhancing how we deliver care, how we're documenting, and how we teach. And this is all the way from virtual nursing, which we'll talk about, to our high-tech sim labs. Today's nurses have access to really powerful tools that are helping us with our clinical decision-making. They're helping us streamline workflows and also improving patient outcomes. So on your screen here, you can see the first picture there in the middle. This is a nurse doing paper charting. We used to all do paper charting, so we would handwrite all of our assessments out, our care plans, and that was, we had a really good handwriting because we want other people to be able to interpret that. The handwriting did bring its challenges because our physicians would also be documenting, and as nurses in paper charting, we had to try to interpret and read what that was, and that sometimes was time consuming. It also introduced potential errors because if you misread the handwriting or look at a decimal that's in the wrong place, that could ultimately lead to some not great outcomes. So I'm very grateful. We have transitioned and now have an EHR or electronic health record. Some people call it the EMR, electronic medical record. But EHRs are centralized digital repositories of all of the patient information. So it gives us that real-time access and communication to make it easier for the healthcare team and certainly nurses. And an example of this could be when our nurses are preparing for their shift switch or bedside safety handoff is what we call it. They're looking at the patient's medical history, looking at the lab results, treatment plans, et cetera, just to make sure we have a smooth handoff. We have that continuity of care and make sure that I, as the nurse stepping into this position, am well informed on what this patient is going to need. And the impact that all of this has had is really enhancing that continuity of care. It has helped reduce documentation errors, and it again streamlines that communication. And at Methodist Hospital and Health Partners in Park, we have our EHR is called Epic. So I'm going to go into our next one here, and it's automated dictation for nursing documentation. I'm not sure if anybody on this call has heard about it, but this is definitely on the newer end of things. Methodist currently does not have this functionality, but we are hoping to have this in the future. So just if you were to do talk to text on your phone, this is kind of what this is getting at. Nurses could use their voice to document in the medical record. Whatever they would dictate would just blow right into those flow sheets. A few organizations are actively working on this and getting pretty far. I know Mayo is partnering with some organizations right now. And at Methodist, we're very interested in it. We just aren't quite to that point yet. This technology has been around for some time, and really a lot of our clinicians or physicians have been using it. And the reason why it's been a little easier for them to adopt that is because the physicians often document in notes. So when they are dictating, it blows right into the note, whereas nurses, we do a lot of our documentation in flow sheets. So it's just harder to set that up. So we're hopefully going to see that in the future, but a lot of companies are actively working on this because they know this is going to help from an efficiency standpoint. And this voice to text software, it lets them certainly dictate their assessments, but also their care notes. And this is going to improve their accuracy and their speed. So an example of this could be when the nurse is in a patient's room and they're looking at a patient's wound. They could use their voice to document for them and dictate their observations, like the location of the wound, or the size of the wound, the appearance and the color and the condition. And so all of this is saving them time because they're not having then to sit down and document everything. And it's giving them more time back with their patients. Nurses went into healthcare to be with patients, to walk with them, to talk with them, to care for them, to assess them, and not so much, right, be in the charts documenting. So when we talk about burnout, this is potentially a tactic that could really help us because it will free up that nurse to give them more time with their patient. The next one is mobile health applications. And an example of this are at Methodist Hospital, we use hospital issued iPhones. And I know not every hospital has this across the state or the nation, but this is how Methodists what we use to communicate to our care teams. This is how we would scan a patient's medication and also potentially document. So all of our nurses and frontline teams, they come in at the beginning of their shift, they get their hospital issued iPhone, and then they can immediately kind of get to work. And you can see a picture here on the screen. We use an application called Rover. So we do a lot of our documentation through there. And then we also use our iPhones to scan the patient's medication, which I'll talk about in just a moment. This has also really saved us time because nurses often, right, are on the go, on the run. And if we could quickly put something into here, that could also help them save a lot of time. So the mobile health applications have been really great in advancing our care. And I will say one thing, these devices, they don't work outside the building. If they were to accidentally leave with somebody, they are not activated. So they can only use them to contact different members of the healthcare team, page a physician, or send a message to their charge nurse, etc. The last item on here I wanted to talk about was real-time monitoring systems. So Methodist Hospital has a few of these, and I want to explain what this means first before I talk about the two examples. But real-time monitoring really provides nurses and clinicians with critical information right at their fingertips. So a few of these examples would be wearable devices, and then well, I'll jump into that. I'll talk about the wearable devices first, but these are essentially sensors that alert nurses to those subtle physiological changes that can happen in our patients, and that can enable quick interventions and then potentially reduce those complications. And this monitoring, it helps with the continuous collection and display of patient health data. And many of the different things we can monitor could be like heart rates, oxygen saturation, respiratory rate, blood pressures. So why are these so important? So instead of relying on periodic vital sign checks or periodic assessments, et cetera, nurses can now detect subtle changes in patients' conditions as they happen. Because again, these wearable sensors help pick up on different things. So this allows for those nurses to have faster intervention. It allows them to have that more precise care and also the early detection of any complications that could be occurring in the patient. So an example of this is a wearable wireless heart monitor that we partner with an organization to be able to serve our patients. So this wireless heart monitor, it records heart rhythm data for up to 14 days. And it helps that team understand if that patient is having any irregular heartbeats that might not be captured when they're in the clinic or in the hospital. Because if you're in the clinic and you have like a snapshot, you have that EKG where they put all the leads on your chest, that is offering a snapshot in time. We've advanced now where we have these sensors that can just be monitoring these patients at home. And it doesn't really impact their quality of life because it's just a little sensor that they wear under their clothes. But it has allowed us to be able to pick up on those subtleties and be able to put an action plan in place to help these patients. So by moving forward with these, we can really make sure our patients are getting that timely care and prevent something bad from happening before it does. All right, this is my second and last slide on technology and innovations. There's the three things I wanted to speak to here are the technology-driven patient safety systems. The one I really want to highlight here is the bedside barcoding medication scanning. And then the second element is the smart infusion pumps, because I'm not sure a lot of people are as familiar with those because those are on the newer side. So with bedside barcoding, when the nurses have their hospital issued iPhone, they can scan both the patient's ID band and the medication to ensure the correct drug and the dosage before they ultimately administer. And this helps reduce medication errors, enhances compliance with safety protocols, and also boosts their confidence in making sure that's accurate. The second example, and Methodist is actively in process of implementing all of this, is the smart infusion pump. So a lot of our patients, they have IV pumps, they get fluids and medications. Well, Health Partners Park and Methodist have now partnered with an organization, and we have been launching these new smart infusion pumps. So they have built-in safety features like drug libraries. They have dose limits. They have real-time alerts. And these pumps help prevent mistakes such as incorrect doses or infusion rates by alerting that nurse when they're plugging in all of the information into the pump. The smart pump will alarm and say, nope, what you're plugging in here is outside of the safe parameters. So it automatically alerts those nurses. Another great thing with these smart pumps is that they can be integrated automatically with the electronic health record or the EMR to automatically document for that particular nurse. So if I'm plugging that into my IV pump and I start the medication, it automatically links to the electronic medical record and documents for me. Whereas before we always had to do that and then start to populate the MAR with what we just administered. So this is making sure that it's helping with time and efficiency, but also it's making sure that the correct information is getting into the patient's medical record. The next thing on here are the nursing simulation labs, and I won't spend too much time on this because I do believe in the previous coffee chats, we've, I think, talked a little bit about sim labs. But this is really up and coming, and we should be really excited because Ryan and the Sim Lab team do such a fantastic job with all of this. So we do have something like this in place. There is a hub at Methodist as well as regions. And this is really, this is the key to innovation for us. The Sim Lab is enhancing our learning for our nurses and our patient care by providing that really safe and realistic environment to practice their skills in decision making. We have really high-tech mannequins This isn't probably the best picture you guys are looking at here, but we have really advanced mannequins that we use where we can create virtual scenarios to allow those nurses to simulate real life clinical situations like emergencies or if a patient is coding in the hospital, we can simulate that experience. So when a nurse experiences that for the very first time, they're a little bit more comfortable because they've done that in the sim lab. And the sim lab obviously does not have any risk to actual patients, which is really nice. It's a really good learning environment. So these labs, they provide, they help enhance that clinical judgment for the nurses. They help with teamwork because you're again in those code situations. And then they also boost the nurses' confidence and it helps them transition from maybe being a nursing student into being a first-time nurse because you practice all of those skills. The SimLab also offers immediate feedback. They do a lot of debriefs, reflection. They talk about any errors that were made, so it offers that real-time feedback. And all of this is ultimately leading to safer and certainly higher quality patient care. The last thing on this slide before I transition is talking about virtual nursing. This is something that has been in place, I would say, for a few years now across the nation. Methodist Hospital does not currently have virtual nursing. However, it's always something that we're looking into because we want to make sure we're supporting our nurses. Virtual nursing, if you haven't heard about it, it's a really innovative model that allows our nurses to provide care remotely using the video, phone, or any digital tools. So you could have a hub of virtual nurses, and they are ultimately supporting those bedside nurses. These virtual nurses could kind of beam in, if you will. If you look on your screen there, you can see the bedside nurse is talking to the virtual nurse. That virtual nurse can help do a lot of different things, like they could do the full admission for the patients, which sometimes can take that patient and the nurse up to 45 minutes to complete. The patient admission is a really important process, and that virtual nurse can be taking their time, explaining things to the patient and documenting everything in the chart while that bedside nurse is maybe caring for other patients or doing something else for the patient. So the virtual nurse is a support to that bedside nurse, freeing them up so they can do more hands-on care. These virtual nurses can also monitor patients in real time, which certainly allows us to improve safety and potentially allowing for early intervention. So if they see a patient is getting up out of bed, that virtual nurse can say, patient Susie, stay in bed, make sure to hit your call button. Or they could call the bedside nurse and say, you need to go check on your patient in room 20. They're about to get out of bed. So it offers a lot of that support to the bedside nurse and again, to our patients as well. So this model certainly helps with our patients, but it helps nursing support, helps care coordination. And then when we think about how challenging, not necessarily challenging, but more complex, healthcare is becoming, these types of innovations are going to keep nurses at the bedside because it's supporting them. It's helping prevent that burn. And it's also virtual nursing could potentially retain those experienced nurses. So if I perhaps hurt my back and I no longer can move or shift patients and I don't meet the job requirements because I can't lift or boost a patient, I could potentially sit in this virtual nursing hub and be able to still provide care to those bedside nurses. So as a nursing workforce, we're not losing those experienced nurses. They are still there for these newer nurses to call virtual nurse Abby and say, Abby, walk me through this policy, walk me through this procedure. How do I do this? So these virtual nurses not only help give time back to the nurse at the bedside, but they also help act as like a master preceptor or a mentor to these newer nurses. And if you can think about it on night shift, that's often right where some of our nurses do start. So these virtual nurses offer that extra layer of education, guidance, and support for these new nurses, which is also a nice patient safety feature because these nurses can ask a question before going into the patient room. So before I exit our innovation and technology section of our conversation today, I just want to stress that the technology does continue to redefine what it means to be a nurse. We are trying to be nimble, but whether you're at the bedside or you're behind a screen, like being a virtual nurse, or maybe you're in a sim lab, nurses are starting to use these tools to really enhance safety, help efficiency, and the quality of care. And as these technologies continue to evolve, nursing practice is going to continue to grow and be more adaptive, connected, and also really patient focused. All right. And Abby, I know I'm running short on time. So maybe I'll just say two quick things if that's okay, and we'll just have a few minutes for questions. Is that okay?
That is totally fine. Thank you.
Sorry, I get so excited about this.
That's okay. I love it.
All right. So this, and if anybody has to drop off, that's totally fine too. We can, if you have questions that we're not able to answer, I'm happy to connect with you for coffee in person. But this slide, I just want to highlight, this is some of the great work of our teams and what Methodist, Park, and Health Partners is doing to recruit nurses from the different programs as well as retain them. We have our New Path program, which is really special. Methodist was the first one in the state to have this. This is a program where we partner with different nursing schools and we offer serial clinical experiences to our nursing students and certainly partnership with the nursing schools. So what we try to do is offer priority to some of these nursing students to give them as much exposure to Methodist Hospital as possible. So maybe they do this clinical at Methodist and this clinical, and then we invite them back for like an internship or other volunteer roles. Maybe they want to be a nursing assistant. So we try to give them as much exposure to Methodist Hospital to see if it's a place where they want to work. And so that certainly helps us recruit because they see how great our culture is. And then it helps them, once they step into the role of the nurse, it helps us retain them because they already know, like, this is the place I want to work and this is great. So the New Path program is really great. Retention and support, we have a really strong and robust shared governance team. This is really where we give our nurses a frontline, we give them a voice to partnering with our nursing leadership. It really empowers them and allows them to actively participate in decisions that impact patient care, patient safety, and daily work. And these are monthly meetings where we have 150 of us and we all come together from all the different nursing units and look at how we can improve patient care. We have our mentorship programs there where we pair new nurses with our experienced and seasoned nurses. And then this is my last slide. I certainly couldn't talk about nursing without talking about our recognition programs and our DAISY Awards. But you can see all the kind of the fun pictures here. We do a monthly DAISY Award, and the DAISY Award is the highest recognition a nurse could get. It's an international award. DAISY Award. A statue called the Healer's Touch. That is from a tribe in Zimbabwe. They make that. So DAISY Award, the foundation partners with them, and we are able to administer those awards monthly to nurses that are making an impact. These nurses get nominated. And so then our shared governance team blinds all the applications, and then we pick one DAISY Award winner every single month. So it's a really cool celebration. Sometimes we get the patients and the families to come back, and we all surprise that DAISY Award winner. So up here is a picture of that, and then different pictures down here. And then lastly, I just want to end by saying we have amazing support around professional development, and our foundation is key to this. They have a lot of different funds for us to support our frontline nurses as well as our nursing leaders to go to different conferences, which you can see down there on the bottom left. We were able to send almost 10 nurses to this conference in Boston to bring all the different learnings from across the nation, bring it back to Methodist Hospital. So it is a really great thing that we're doing for our nurses there, and just appreciate the partnership with the foundation. Okay, I'm so sorry. I'm going to end my slideshow so I can see the bigger screen. And would love to know if any questions Abby came through, or if the group has any.
Yes, absolutely. We sure do. So we do have a question right here. How can we help support our nurses and ensure there are enough nurses to support our patient and healthcare system?
Yeah, I think that's a great question. We during COVID times, I think you probably remember seeing a lot of pictures of nurses, with their head in their hands like this. It was a really hard time with COVID, and we are now coming out of that. We're seeing our numbers in the nursing schools increase. At Methodist Hospital, we have very few frontline nursing positions open. So we're in a good place right now. However, we need to, the nursing profession and the public too, we just need to continue to raise up our frontline nurses and really show how great the profession is. And I think we do that by sharing patient stories and reminding our existing nurses why they went into nursing. Because again, burnout is a very real thing. So by addressing it, supporting our frontline nurses, and then also promoting nursing as a profession and how great it is, I think we'll continue to see the current enrollment in the nursing schools go up, as well as in the hospital settings. And one more thing along those lines is professors. We are seeing a shortage of nursing professors across the nation, not just in Minnesota. And that is something that we're working with the AONL, which is the American Organization for Nursing Leaders. We are working to partner with them and our legislators at a national level by trying to make sure we can compensate our professors in the nursing schools. One of the main reasons why there is a shortage of nursing professors, thus making the nursing classes smaller, is because of the compensation piece. And so we just need to do what we can to advocate for our profession, advocate for those professors, and then hopefully be able to support and make it an area that other nursing leaders and frontline nurses want to go into.
Thank you so much. And kind of along those lines, in terms of awareness, how can we increase awareness of APNs among the public and other healthcare professionals, in addition to trying to do what we can to recruit nursing professors?
Great question. I think we should leverage social media as well as our policymakers. But I think starting with social media, if we don't start to increase the number of APRNs, our access, especially in those rural areas, is going to be in jeopardy. And I think we probably heard too, we are predicting a physician shortage as well. So it's even more important that we have more APRNs thinking about it going back to school. But I do think we need to use social media and kind of tapping into those different platforms. And again, same thing with bedside nurses, sharing the stories about why that role is so amazing, the impact that it's had on them personally. And then, going out and doing different like community fairs and just, verbally getting that word out, I think would be something that this team could do. And then as people are questioning what does an APRN do, using your network and connecting that person with an APRN to be able to explain what that role is. I know we're way over time, but anything else that's come through that we should?
Yes, one more thing is with the nursing shortage on our hands and everything like that, what are we doing at Park Nicollet and Health Partners to combat burnout and improve well-being among nurses?
Yeah, I would say looking at these different innovations and technology, I think is going to be I wouldn't say low-hanging fruit because that they're sometimes challenging to implement, but things like virtual nursing where we can give that nurse time back at the bedside. They went into the profession for that. They want to be next to that patient. They don't want to be documenting in the chart the whole time. So I think giving them time back there, and then also with the stress as well, having that virtual nurse be able to provide that extra support, that extra education to those newer nurses coming into the picture. Care for patients has become so complex. And so if we don't support those frontline nurses as they're just entering the profession with these experienced and with these seasoned nurses, we're going to see more burnout. So I do think innovation and technology is one of the keys to looking at that, as well as the dictation piece that I talked about, that talk to text, that will allow nurses, hopefully relieve them of some of the burden of documenting every single thing. Because if you ask anybody, that is something that is very time consuming, and they would much rather spend that time with their patients. So I think that will help. And then from a mental health standpoint, I feel Health Partners Park have done a lot of good work around this. We are offering a lot of resources. And, we now have this application where anybody can sign up for therapy sessions. You can sign up for individual sessions. You can sign up for group sessions. If I'm a frontline nurse and I'm struggling because I had a really tough code or a tough situation, I can go in through that app and be connected with another nurse or another colleague. And the last thing I'll say with that is our spiritual care team. We have a fantastic spiritual care team that comes on site. We have an on-call structure, and if a nurse or healthcare team member has experienced something really tough, that spiritual care team deploys someone to immediately debrief, and then we follow up with that nurse to make sure they're getting all the support that they need. Yeah, good question.
Well, Melissa, thank you so much. I just want to be respectful of your time. And if any other questions come through, I'll make sure to forward them your way. But thank you again for an excellent presentation today, and happy Nurses Week to you too.
Thank you. Have a good
Yeah.
day, everybody.
Thank you.